I now request Hajiya Zainab Sharif, Director and Head of Department Traditional Complementary and Alternative Medicines in Federal Ministry of Health, who is ably representing Honorable Minister of Health, His Excellency Dr. Osagie Ehanire, to kindly deliver the message of Honorable Minister.
I want to align myself with the established protocols for want of time, but not without appreciating the Indian Embassy for this wonderful day, the day of International Yoga Day. Do we appreciate them by clapping for them once more time? Thank you very much. Before I speak the message of my minister, and I also want to appreciate also my permanent secretary, who has directed me also to say hello to all of us here today. The relationship between India and Nigeria can never be overemphasized, especially in the aspect of health care. We have come a long way, and it is important that as Nigerians, we appreciate the Indians for their kind gestures to us Nigerians, especially in the aspect of promoting Ayurveda. Not only Ayurveda, let's use the word Ayush, because these are Indian systems of medicines or healthcare systems practiced in India. And that should give us a lesson to Nigeria, because when we collaborate, we should learn from our collaborators, because they have done it and they are better than us. Humility should be our watchword, so that in similarity with our population and other traditional systems that are common amongst us, we can learn from them and improve on our own, and vice versa. Having said that, let me speak, or let me read the speech of the Honorable Minister of Health, Dr. Osagie Ehanire. I am delighted to be here to participate in this year's celebration of International Yoga Day. It is worthy to know that the two countries have built a robust bilateral collaboration and cooperation in the area of promoting and developing our various traditional medicine practices over the year. My invitation to this event is a confirmation of that relationship. Let me pause and say that the Ministry of Health, through the department, is well represented here. This is to show the seriousness we take to this collaboration. If you are from Ministry of Health and other related integrative medicine practitioners who also practice yoga, could you say hello to all of them? So, thank you very much. Like I said, we have had a long-term relationship, but let me focus on the subject matter of promoting our traditional healthcare systems. You may wish to know that your traditional medicine is your own indigenous medicine, is the medicine of the people, is your culture, and you cannot forget your own culture. Our grandparents had their own healing systems. But when you go to learn from other traditional medicine systems, just like we are doing now in India, we are now looking at it as complementary and alternative medicine. This is to harness our own traditional medicine. So traditional medicine and complementary medicine, they all go together. They define nature and they define traditional systems. In 2008, a delegation from the Ministry of Health visited India in a bid to study the Indian system of medicines or healthcare systems. I want to say that in India, they have a whole ministry of Ayush. You wonder why, because of the importance they attach to their own systems. Ayush, Ayurveda, Yoga, Unani, Siddha, Homeopathy. These are systems that are health systems, which clearly defines what we have done today. We look at healthcare purely from the curative angle, but that is not the right thing. Healthcare is encompassing, and that is what yoga has taught us today. A complete state of physical, mental, social, and spiritual being, not just merely the absence of disease. They have done that. We had a one-week tour, and we were able to learn more from them. And much more than that, we have benefited from their seminars and their programs. They have invited some members in our ministry and in our related agency to go and study and learn their own health systems. You can see they are not selfish. We are open to visiting. We're exposed by professors in various fields of traditional medicine, and we're also visiting, we visited all their industries, including Doba that made the presentation today. I am happy to see that Doba has grown from strength to strength. In 2008, when we visited it, it was not as big as it is today. He said now is one of the most global world industry in the promoting Ayurveda medicine. I understand that yoga is an invaluable gift of Indians' Asian tradition, which embodies unity of mind and body, thought and action, restraint and fulfillment, harmony between man and nature, a holistic approach to health and well-being. For us Nigerians, we should begin to focus and understand the definition of health, not just taking those synthetic pills. Those pills have a long-time side effect. I speak as a pharmacist, trained to produce medicines, but what we know, holistic medicine is the way to go, encompassing nature in its entirety. That means promoting the use of natural products in terms of diet and in terms of medicines, either as herbal medicines or as phytomedicine. I congratulate the good people of India on this occasion. I'm aware of the oncoming Ubuntu International Yoga Conference, and my minister has asked me to make sure I draft a speech for him so that he can clearly be able to represent Nigeria in that conference through his own video message. And I think very soon the representative of the Indian embassy will be in the ministry to get the message. Let me assure you that Nigeria is committed to the development promotion of traditional and alternative medicine, including yoga. In this regard, Nigeria government is currently doing the following steps. What have we done? We have tried to promote through the department. We used to have a division. Now we have a whole department of traditional, complementary, and alternative medicine in a bid to have effective and sincere collaboration with partners such as the Indian, so that we can be able to, among our civil servants, who often, most of the time, have hypertension, diabetes, they have to swallow these pills. But much more than that, you may not need those pills. What you need is the complete state of maybe practicing yoga. That means improving in the quality of your mental stress and also through a healthy diet. We are also about to collaborate to set what we call the TCAM hospitals, whereby patients should have the opportunity to visit the hospitals of their choice, as it is done in India and also China. You want to go to the Orthodox hospital, you can do that. You want to go to the complementary, or you want to go to the nature's part of, you should have a free choice. And that is holistic approach. We cannot achieve universal health coverage if we do not promote these three clear health systems in our own country and in developing countries generally. I want to appreciate India, and particularly, specifically, I want to appreciate the Indian High Commissioner, who has been with us. Anytime we invite him on issues that has to do with traditional medicine, he's ever ready to be there personally and to promote this aspect, and in a bid to support Nigeria. I want to end my speech by saying that today we are privileged, all of us here, to have gone through this exercise. Those who are not here, they have missed it. But I think we have been able to realign yourself. No more distress, the challenges we are facing. God is there. At the end of the day, God will see us through. A country that needs to develop must face such challenges of insecurity. But the greatest asset is to believe in God. And you can believe in God by practicing yoga to improve your mental capacity and to improve your well-being. And finally, our traditional foods, which are indigenous foods. That is the similarities we have with the Indian. They don't ignore their traditional foods. We should also be able to appreciate our traditional foods to improve the quality of our lives and the well-being. Thank you for listening.